Welcome everyone, and thank you to those joining us live and to those listening in afterwards. On behalf of my colleague and co-moderator Ash, I'd also like to warmly welcome our guests today, Pharmacy Heroes, who I'll be introducing very shortly. I'm Lina Badr, lead for workforce transformation and development at the International Pharmaceutical Federation, FIP. Founded in 1912, FIP is the global body representing over 4 million pharmacists, pharmaceutical scientists, and pharmacy workers around the world. Our vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, science, and education. At FIP, I'm also the lead for our COVID-19 online program, Responding to the Pandemic Together, through which we deliver webinars, webcasts, and more virtual events, where we tackle pharmacies' responses to COVID-19 together, of course. We're pleased to be delivering this event, the 5th one in the Responding to the Pandemic Together series, but also the first Hearing from Our Heroes episode. We know that the world's pharmacy team is fighting COVID-19 everywhere, working closely with other healthcare workers and often putting their lives at risk to protect and care for patients and the public during these times. So as part of this online program, we will be featuring regular Hearing from Our Heroes webcasts, where we talk to pharmacy heroes from different countries, learn about their experiences, and share those stories with you. This webcast is delivered in partnership with the Polish Pharmaceutical Group and their Pharmacy Heroes campaign, which we'll tell you more about today. It is my pleasure to introduce my co-moderator and guests today. I'll start with Ash, my co-moderator, who will be leading the discussion today. Ash is a community pharmacist with 3 pharmacies in England. He's also the vice president of FIP and member of the FIP Bureau. In the UK, he is board and assembly member of the Royal Pharmaceutical Society of Great Britain. Ash is also board and executive member of the National Association of Primary Care and the Professional Network Chair for London. Hi, Ash, welcome. Thank you for joining.
Hello. Thank you, Lina. Great to be here. Great to have time at the moment to be able to do some and listen to some of the things that people are doing.
Great. I'll now introduce our global pharmacy heroes. From the Philippines, we are joined by Nelly Nonette Ueno, hospital administrator and community pharmacist. Nelly earned her master's in pharmacy at the University of San Carlos, Department of Pharmacy in the Philippines. She is currently engaged as a hospital administrator of the Visayas Community Medical Center in Cebu City, Philippines. She's also the Southeast Asia Regional Manager for Original Campus, an Australian school for leadership and entrepreneurship in Melbourne, Australia. She was the chairman of the Department of Pharmacy in the School of Healthcare Professions at the University of San Carlos from May 2012 to July 2018. Ms. Ueno is an active member of FIP's community pharmacy section and active at as an FIP PharmaBridge alumna. She was also a member of the FIP Global Pharmacy Observatory Advisory Committee as its regional ambassador. Welcome, Nelly.
And it's yeah, I'm very pleased to be part of the team, and we will be sharing our experiences when we approach COVID.
Thank you, Nelly. We're really, really honored to have you with us today. On to our next hero. From Spain, I am pleased to introduce community pharmacist Jaime Acosta Gomez. Jaime is a member of the FIP Community Pharmacy Section Executive Committee. He's also a member of FIP's Technology Forum. As a community pharmacist, Jaime played a significant role over many years on different levels. His work for a global communication platform within CPS, the Community Pharmacy Section, including a long-term plan for developing 16 global webinars that have reached more than 18,000 colleagues from across 150 countries. He is an experienced community pharmacist with a strong passion for the future of pharmacy and a deep understanding of the community pharmacy's environment, as well as healthcare's new and changing needs. His leadership skills have been recognized twice by the World Health Organization. With the World Health Organization Armstrong Institute, he received the Johns Hopkins Medicine Scholarship in 2013 and the WHO Scholarship Grant for Upcoming Leaders in 2011. An award winner. Hi, Jaime. Nice to have you. We can't hear you. You might need to unmute yourself. Sorry. And we are expecting to be joined by a colleague from Lebanon, Luna, who hopefully will be joining us soon, and we'll introduce her as soon as she does. Representing the scene in Pakistan and on behalf of the Pakistan Pharmacists Association, I'd like to welcome Nadia Bukhari. Nadia is an academic pharmacist at University College London and is UCL's Global Pharmacy Ambassador. She has been recognized for her outstanding contributions to the profession by the Royal Pharmaceutical Society and is the youngest female and youngest Asian to be awarded the status of Fellow of the Society. She is the first Muslim woman to have been elected onto the National Pharmacy Board for England, which sets the strategy for the profession and influences on a governmental level. Importantly, Nadia uses her platform to be a vocal and prominent advocate for women's rights and is an ambassador and on the board of trustees for Pakistan Alliance for Girls Education, PAGE, a charity organization supported by the government of Pakistan, which promotes gender equality in education. Nadia is also the global lead for gender equity at the Workforce Development Hub, and we work closely together. Hi, Nadia.
Hi, Lena. Absolute pleasure to be here today and to represent Pakistan.
Thank you for that. Last but not least, we are also joined today by Piotr Merks from Poland. Piotr isn't on video feed, but he is down the line. Piotr is here with us today representing the Polish Pharmaceutical Group, our delivery partners for this webcast, as I mentioned earlier. He is the group's advisor of its management board for innovation and science. He's also here with us today as the campaign lead for PharmacyHeroes. Piotr is a Polish licensed pharmacist. He first started his career as a pharmacist in the UK primary care setting, delivering public health interventions to patients in underserved communities. Currently, he is the adjunct professor at Faculty of Medicine at the University of Warsaw, assistant professor at the Faculty of Pharmacy at the Collegium Medicum in Bydgoszcz, general secretary at Employed Pharmacy Europe, and advisor at the Polish Pharmaceutical Group. Welcome,
Lena,
Piotr. Hi, Luna. Yes, welcome online.
but I can't see no one. I see no one.
Hello, everybody. Thank you very much for introduction.
Thank you, Piotr.
Thank you so much.
I'll just double check that Luna's hearing us fine. Hi, Luna.
Hello, how are you? Do
We're
you
very
hear me,
well,
but do you see me?
We can't see you yet, but that's okay. We have you down the line. Thank you so much for making the time to join us. I know it wasn't easy for you today. I'll just use this opportunity to introduce you now. Luna Bizri from Lebanon is a community pharmacist. She received her PharmD from the Lebanese University and pursued her study with marketing degree from the American University of Sciences and Technology. Since 2008, she's founded and has been managing her own pharmacy, Luna Farm. Currently, she is the adjunct preceptor of the Lebanese American University and the Lebanese International University. She's also an active member of FIP's community pharmacy section, which you've heard about more than once today already, and a member of FIP's non-communicable diseases working group. With more than 20 years experience in academia, community, and industrial settings, Luna does have a solid experience in active research in these areas with multiple publications in renowned journals. Welcome, everybody, and welcome, Luna, especially for joining us.
Thank you.
Before I hand over to Ash, who will be leading the discussion with our heroes today, I'd just like to quickly turn towards Piotr, who's down the line with us, campaign lead for PharmacyHeroes and representing the Polish Pharmaceutical Group. Polish, I'd like to ask you about this initiative, how it came about, and how everybody can be engaged in it. But first, I'd like us to watch this short promo video about PharmacyHeroes campaign. Thank you for that, Piotr. That was a wonderful video. Piotr, can you tell us more about the Pharmacy Heroes campaign, how it came about, what it aims to do, really?
Excellent. Thank you very much for this and for having me here. So first of all, we are very happy as Polish pharmacists that this campaign was born actually in Poland, because we haven't been much active recently for many years. So it is very well received over the world as well. So this is very good. And first of all, thank you very much to all our partners in FIP for people who understood basically our message, and for those who joined us so fast that this campaign actually gathered for today 134 countries around the world. So thank you very much for instant basically sending us messages and joining us all over the world. I think actually it's worth saying that the campaign was born from the observation of our employees of the Polish Pharmaceutical Group. Polish Pharmaceutical Group is a wholesaler who every day try to care about maintaining the constant supply of medicines of thousands of pharmacies in Poland. Every third pack of medicine in Poland is actually delivered by PGF. So basically, we try to look for this delivery chain from the beginning. So from the simple people who are just packing the boxes, and then basically it was so moving that we decided to spread the campaign towards pharmacists and try to show basically and pay the attention to the commitment that they do. So as I mentioned, because the pharmacists were not so well recognized at the beginning of the COVID-19 pandemic. So we thought it would be very good to actually try to show pharmacists, but we didn't even expect that it would just go global. So first of all, we wanted to show and appreciate solidarity. Basically thinking about how to do it, we came to this conclusion that the time of crisis is actually very good to show pharmacists, and not only in Poland but around the world. So this is how the idea arose. So from the basic drug delivery, from the people who are just working in the wholesaler, to the pharmacists who are delivering basically the goods to the patients at the last basically frontline towards the patients. I'll tell you a few statistics. At the moment, 88% of the Polish surgeries are closed. So all these people basically are going to see face-to-face visits in the pharmacy, mainly treating minor elements. So this was very, very successful time for us. And obviously, to be able to have a global sort of range of the campaign, we made our first steps towards FIP. It's not the first time that FIP helped me with this kind of project. So we presented the idea, and it was extremely positively sort of received. I'm very happy. Thank you to all the secretariats for all your support in this campaign. So thanks to FIP, we managed to reach so many pharmacies around the world and so many countries. And a few words about how the action looks basically. So first of all, it's about photographing yourself as a pharmacist with the letter P. So you make the symbol with your hands, and then basically you make a picture and then you send it to our email, pharmacyheroes@pgf.com.pl, with the information about the country you come from, and also mark the place where you're exactly from. It is very important also that you don't forget this, because later we try to finalize and make a summary of the campaign, and we'd like to just give some statistics for FIP from the campaign. So people can visit basically pharmacyheroes.com as well as the Facebook fan page. The action lasts only a few days, but it is extremely sort of popular, and it's constantly developing. So I think that the most moving for me, at least, and maybe for you as well, was when children actually began to join the campaign, and they were sending pictures thanking pharmacists for the hard work. There were not only children, but also children with some terminal problems like cancer. And this was even more moving, basically. So when I showed these pictures, sending from pictures with the small movies, it was absolutely heart moving. Observing the development of the campaign in few days, basically, we also focused on a few examples, basically, like translating the website into a few different languages. For instance, English, French, Spanish, Russian, and of course, Polish version. So we hope basically that thanks to this, we'll reach more pharmacists to deliver the message that we are the pharmacists, we are proud of it, and we are here to support the general public. So to sum up, we invite all of the pharmacists basically, and everybody really, to show solidarity with pharmacists. Please use the Facebook website, the fan page, and also try to take the advantage of this possibility and inspiration to exchange basically our experiences, like some friends from all over the world especially myself, I really like the movie from Taiwan. It was absolutely amazing what you've done, and it made me laugh during the pandemic. So we are very open to any kind of cooperation, also with partners, with organizations, to be able to build an international community of people to basically show our role during the pandemics and natural disasters. Obviously, no matter what, regardless of the nationality or skin color, religion, language, we are all together. We have the same mission, and we have the same moral spine. And I think it would be a great value for this project when every single pharmacist all over the world will join us together and share this good news and information. So thank you very much for having me here and for your help. Thank you very much to FIP.
Thank you for that, Piotr. A very comprehensive overview of a full-fledged campaign. And I think it's really important to focus on the impact of this. And you've touched on this in terms of advocacy for the profession, but also reaching to the young and the children to explain to them the importance of pharmacy and the pharmacy team as part of the healthcare system. I do want to ask you about what are the intended or aimed outcome? What would you want to achieve by the end of this campaign? And you mentioned that it does have an end date. Can you tell us a little bit more about that?
Absolutely. I mean, not every country is so lucky as England, for instance, or America or Canada, that they have a very developed practice model. There are many countries who are a bit behind, and we have to show to the stakeholders and governments the role of pharmacists, how they can support the healthcare system. At the moment, we are trying to, I mean, the campaign is just the first step, and COVID was actually a great opportunity to make some research and show that basically pharmacists are on the front line. And they can really help the doctors and nurses and everybody basically not to collapse the system, because at the moment we have so many patients with COVID basically, and the system is so overloaded that pharmacy are frontline. I can just give you some statistics. In the first 8 days of pandemia, basically we had 21 million of people visiting pharmacies. Yeah, we have around 12,500 pharmacies in Poland, and we have 38 million people. So half of the population visited pharmacies in the first basically 8 days. So this statistics is, for me, it's unbelievable. And I think it should be used in many countries in the same way. Obviously, try to promote to the stakeholders, to the government, that the system, the healthcare system, desperately needs supporting pharmacists in this model. Obviously, it's all very complicated as well, but hopefully it's just a small, little, tiny first step towards those countries who basically would like to use this campaign as trying to motivating the local government.
Thank you for that, Piotr. We're really, really welcoming you today. Thank you for that very, very important introduction. And I think towards the end, we will be engaging in that campaign and doing our own peace signs with our hands. So looking forward to that bit as well towards the end. That's it from me at the moment. Well, I'm really happy to be handing over the discussion now to Ash. Ash.
Thank you. That's really interesting and really fascinating, because again, just hearing about the recognition of pharmacists around the world and some of the things they're trying to achieve is really important. I think the stories we'll hear today will tell us more about how valuable, in a way, pharmacy has proved to be as this pandemic has developed, and the role that pharmacists have played as heroes in helping to meet the needs of their populations. So I'm going to ask you a series of questions, if that's okay for all of my panelists. There are 3 questions, and so I'll ask you the first one in turn, and then go on to the second one and third one. And I'll change the order slightly to keep you on your toes, to make sure you're paying attention and not trying to avoid listening. So I'm going to start with Luna for the first one, because I can't see you, so otherwise I may forget you.
I'm sorry. I'm really sorry. Technical problems.
Not at all. It's really important that, you know, again, that we recognize that wherever you are in the world, the difference you're making. So I suppose from your perspective, and this I'm going to ask for everybody, how did it start? What happened when this first broke in your country? How did you respond? How did the people respond? How did the country respond? And what do you think, how did that feel when it first happened?
Okay, so to tell you the truth, when it happened before in China, myself didn't think that it is important. It's something local. It's not our business. It's very far away. But as soon as I have seen that the worst cases, the first case was in Europe, and then the COVID was spreading from one country to another. So it was really alarming. And for this reason, I started to wanted to know what is this COVID and what's going on. And fortunately, the FIP has really put very early, starting early Feb, some FIP pharmacist guideline and instructions. And then they started very early also their webinar. And since I am an adjunct preceptor, I gave my students like homework to look at these guidelines, to study this guideline, to look at the webinar, and we had a question and answer. So as a pharmacist, really we were prepared. But let's talk a little bit about the patients, and here is the problem. So first, nobody cared. It's not their business. But when during the 21st of Feb, it was the first case in Lebanon, and people really were crazy. There was our job started to have really to correct their misbelief. They think that they won't catch the COVID because they have the flu shot. They think if they are going to drink vinegar all the time, they will be safe. Even they have taken anisum, you know, the plant, the seed. They're taking the tisane, and people, they were promoting this tisane as a anti-COVID tisane. At some point, really in Lebanon, we had a shortage in this plant because everybody was buying this. So we had to correct all this misbelief, and at the same time educate them, for example, how to protect themselves, what is the prevention measures, to ask the questions about if I have the COVID or not. So this was the first step. But later on, we had the second phase where the studies were everywhere, and the miracle medicines and medications, the chloroquine and the hydroxychloroquine, and everybody rushed to the pharmacy and they wanted to buy it. And you had to work again that, no, you cannot have it. They have serious side effects. It's not intended for you. You cannot take it at home. It was so hard that the Ministry of Public Health issued a legal notice telling people that even if you are a chronic patient, you should have a new prescription where the physician has stated that you are, for example, have I don't know, rheumatoid arthritis, and you have to take this medicine, etc. So it was really crazy. The third part about the patient, that we had to calm them. We had this panic and stress everywhere. What we have done in our team, that we listen, we encourage them to ask questions, we listen to them very carefully, and we answer their inquiries, and really try to be with them, to tell them, don't panic, you don't have this sign, if you do have this sign, etc., etc., and to educate them how to protect themselves, which is very important. So this was also one part. Finally, I had to take care about the risky patients. By that, I mean, for example, the patients with non-communicable diseases, such as the patients with hypertension or diabetes, etc. So I called them because they are my patients, I know them. I asked them to have adequate stock of medication and supplies, because you never know, because with the lockdown, we had the lockdown after a very short while, within 10 days, we have the lockdown in the country. So I told them, please, take your supplies. You never know what's going on. You have to know how to take also the supplies, because they have to know how to, for example, if they are diabetic patients, they have to know how to take their blood sugar level. If they have hypertension, they know how to take their the tension measurements, etc. So this is the part of the patients and what's going on with the patients. Briefly, I'm going to tell you about the team in my pharmacy. So as I told you, as for education for the pharmacists, we were well educated, but for the staff, especially for the people that were going to be responsible for disinfection, etc., we tried to be low with them. So I sent them a video in their native language with the Arabic, which we talk in Lebanon. It was showing how to disinfect, what time you have to leave the disinfectant, how to clean their hand very well, etc., etc. So this number 2. Number 3, we had taken the precautions that I believe everybody everywhere has taken this. We put a plexiglass screen between us and the patient. We used the social distance. We didn't allow more than 2 patients in the pharmacy unless there is at least 2 meters between the first patient and the other. When they entered, we had put a poster based on the recommendation of our Lebanese order of pharmacists, asking the patients, do you have the 3 symptoms, cough, etc., etc.? Have you been in contact with, etc.? So if you have this, you call the hotline of the Ministry of Public Health. If you don't, let's enter to the pharmacy. I have put a gel to disinfect their hand before entering. So this is what we have done. We have stopped in the pharmacy taking the glycemic test. Sorry, the glycemic test and the blood pressure test. And I grabbed the chance again with the risky patients to talk about stopping smoking, about the risk factors, because they have to know though that these are going to aggravate their cases. And I talked a lot about the importance of vaccinations, because this is the good time to talk about vaccinations, because if now they fear, they know that they are praying to have a vaccine. So this is the good time to talk about all vaccinations. Finally, I would like to tell you about the staff, because we had a stressful time. It is really hard to work on the front line with all this fear. Really, it is a fear. At one moment, we had we're not entering till now any packages inside the pharmacy until we disinfected outside the pharmacy, and people are really under stress. They are fearing to touch this, to touch that, even though that we are trying our best, but we have the cash between the hands and we have to all the time clean our hands, etc. And so that's what's going on. And we still, even though that it's a little bit more, let's say, the army is not anymore in the roads, and we have done less shutdown, but we are still working on this part. So that's it, Ash.
Thank you, Luna. That's really interesting about how it's happened. Nelly, what about in the Philippines? How's it been there and for you? Oh, your sound's not come on. You're still muted. I can't hear you.
Can you hear me now?
Yes, thank you. That's it.
Okay. So what happened was that we had a lockdown on the later part of March, but since we have a lot of Chinese coming in, tourists, so we had the first case in Cebu on the 2nd week of March, and then it was very scary because we don't know what to do. And the scariest part was that we had no proper PPE, or the protective equipment for everyone. So we had panic buying for the hand sanitizers, alcohol. The prices were going up, and it was like impossible for us to buy them. And so what we did was we secure the entry and exit access of the hospital. We also created a strict triage for the entrance and ensure that patients go through the proper screening. We also created a special area for the hospital where we will have the take care of those patients who had cough, the fever, with the signs and symptoms of COVID. And then we created teams because we had to isolate teams. We had to send the teams for quarantine after they take care of the patient. So we created teams in 2 groups. So once the team would attend to a patient, after 7 days of work, they have to go to 14 days quarantine. But the difficult part was that we were not able to secure the PPEs. But I think as the months progress and the weeks progress, we were able to secure them and buy the mask, everything from China. And the government were also very helpful in terms of setting up different COVID centers within the city, so that the hospital will not be too overwhelmed with the patients. So there are other I'm speaking in behalf of the hospitals in our area. So what we did was that there's a big hospital assigned to send all the COVID positive patients. So the government is also handling all the testings, and then all positive COVID patients would also be sent to this hospital. So what we do is that with our SARI patient, when they progress to a positive COVID patient, and we have to move them to the hospital assigned to handle this. So what we really lack right now is that, because we have been the difficult part right now is that coming up with a workforce, because for the past few months the workforce has been overworked, and it has also been very difficult to secure the places, the protective gears. So what we did was we had the sanitation tent coming in to ensure that all patients that would come into the hospital are disinfected, and then we also want to ensure that those who will be going out in the hospital, they are not going to bring in the virus out as well. So right now, the government has been setting up another center, a big center like the Wuhan Hospital Center. So we are also supporting that, so that once that is activated, all the positive cases will be handled there, and we will be secured in terms of that patients will be taken care of rather than having them scattered everywhere. So once that is activated, and I think the hospitals will then be relieved of our exhaustion of our workforce. So that's the most difficult part, because our hospital, we only have 6 pharmacists. They're working round the clock, and we also have limited pharmacy assistants. So they're also working round the clock. And so what I did was that one team would work on 1 week shift, and then the other team would work, would have a rest for 2 weeks, and then alternate with that as well. So we gave our pharmacists the vitamins, the shots to protect them from the exposure. And our nurses as well are also working very hard, and the doctors and everyone in the team. We are collaborating together, because every day there are different approaches on how to treat COVID patients. So because this is quite new to all of us. So, and we are very near to the Asian countries with big COVID positive cases. But in Cebu right now, we are still having more cases every day. I would say that we have not contained the virus. We are still on lockdown. We might extend lockdown for another 15 days. So as of the moment, the lockdown was extended until the 15th of May. So it's very sad because the economy has been greatly affected, and it has also caused a lot of mental stress to everyone.
Yeah, it's amazing, actually. Again, just the similarities, but also the differences between what you've talked about. Nadia, well, how's Pakistan dealt with it, and how was it finding how was it when it started?
So I think you're exactly right, Ash. There's a lot of similarities that we're seeing across nations when it comes to how everyone was feeling when the pandemic broke out, and also a lot of similarities in how we're dealing with the pandemic globally as well. Now, lockdown has meant only essential services and commodities are available, and as we all know, pharmacies are one. And in Pakistan, we've got our outpatient departments and doctors' clinics. They're still closed, which means pharmacies are the first point of care. And then, of course, with easy access and no appointments needed, pharmacists are not only providing medicines and the essential services related to medicines, but are also giving support and advice with regards to COVID-19. So I'm here representing the Pakistan Pharmacists Association, as well as the National Alliance for Women in Pharmacy. And I've been speaking to a lot of pharmacists working on the front lines. And I have 3 testimonies from our pharmacy heroes who are working on the front lines that I'd like to share with you. And they're not just testimonies, I think they're also quite motivational as well when I was actually going through them. So the first one is from Dr. Mohammed Humayun, who's a community pharmacist. COVID-19 has hit humanity harder than any other disease in over a century. Being a pharmacist, I feel pride in serving my community, educating people and combating this pandemic from the front line. Pharmacists are an integral part of society, and we will put all our efforts till the very end against the coronavirus pandemic. Our next testimony is from Dr. Tuba Rashid, who's also a community pharmacist. Being a community pharmacist, I am upholding my responsibilities as a frontline healthcare professional to serve a community and to ensure that patients can live healthy, happy, and safe by counselling them to take care of themselves during this pandemic of COVID-19. It feels so good that I have the ability to provide direct consultation, counselling, and preventative measures by educating people and promoting awareness about how to cope in this situation. And finally, Dr. Sarosh Aslam Abbasi, who's also a community pharmacist. The coronavirus COVID-19 is spreading across Pakistan and globally. Pharmacist services are an important pillar in public health, in prevention, and to promote awareness. Pakistani pharmacists have acted efficiently in this pandemic. We have delivered professional service guidance to pharmacists and pharmacies, monitoring and resolving drug shortages, establishing remote pharmacy services to limit direct patient contact, educating the public on infection prevention and disease management, and participating in different activities against COVID-19 spread. Thank you.
Thank you, Nadia. They are very powerful in the way, and the views they express are so relevant to everything that we are hearing and seeing across the world.
Absolutely.
Thank you. Jaime, Spain. Obviously some area where probably is closer to me than many others, and where I've probably seen more in terms of where you've been in advance of the UK. But please, yeah. How was it when it first started? Because obviously it was before it got here.
Well, firstly, thank you to the FIP for hiring me, and thank you to FIP for the effort of developing this very solid guidelines and information, very updated. I know it's taken a lot of work from many busy people, so thank you. As you all know, Spain has been very hardly hit by COVID. We were the third country to be hit. So we did not have much information in advance, as you know, and especially Madrid has been one of the worst places in Spain. 8,000 people have died. I know personally many patients and customers who have lost their loved ones. Very dramatic situations coming to my pharmacy, and I could not have close contact with them. Of course, that's not the most important thing, but that gave a sense of how we community pharmacists were always so close to people, just asking them to stay out of the pharmacy if they had symptoms when they needed us most, or when we could not console our almost family members, because I see them very frequently. I know them not only by the names, I recognize their voices when they enter my pharmacy, and it's been really heartbreaking. Also on the pharmacy part, we've had our share, sadly, in Spain. These 12 pharmacists have passed away because of their will of service. 30 pharmacies have closed, and I would like to recognize their work and sacrifice, send a message of appreciation to their families who are having a very hard time. So it could have been any of us, and we are so proud of their effort and very sad. So going from the bigger perspective, our national council very early suggested our national government to change law in many ways, especially allowing us pharmacists to extend expired prescriptions. Let us dispense hospital medicines that are normally dispensed to our patients, so they could not have to travel to their hospitals, taking advantage of our accessibility. For the first time ever, we have been able to deliver prescription medicines to a patient's home, which is totally new for us, and it's taken a lot of effort from us with pharmacists under a lot of pressure. We also had to deliver to the homes of the patients. Also, we had to take care of a few shortages, not many, thank God. Just it's almost everywhere, I guess, hydroxychloroquine. We were not allowed to dispense patients with COVID, even if they had a legal valid prescription. those were only dispensed in hospital pharmacy. And also with the masks thing, we are lately talking last week about masks. Everything is masks. So regarding the situation in our healthcare system, we've been really in the front line because also because of lack of PPE, protective gear. 40,000 healthcare professionals have contracted COVID and had to stay at their homes. So with that, and many healthcare professionals in primary care moved to hospitals to take care of COVID patients. And the surgeries that were left open were taking care of patients mostly by phone. So they were either closed or contacting patients by phone. And I'm super happy that I'm proud that we could manage and handle all this pressure. Phone, direct messages through Instagram, WhatsApp, uploading, Luna mentioned that, uploading solid information in our social media. So it was not only us talking direct face-to-face to patients, but trying to make our best to improve the knowledge of our patients to take, so they could take the best decisions, and also advising many people when they should go to hospital, and most importantly, when not go to hospital, and giving this peace of mind and assurance to so many people. I'm so proud of pharmacy. So on a personal level, and in the interest of time, I'll be finishing. I contracted COVID myself, and I had to leave my pharmacy in a very uncertain time when everything was, increasing the worries and people being positive. So I had to leave, and I was very worried. I was in permanent contact with my staff, and they did a super good job. They were not working for a salary only. They were really fulfilling their mission to help our patients. And it took me 3 weeks isolated at home while they were taking care of everything, my pharmacists, my technicians, my cell assistants, and I cannot recognize it enough. Of course, I acknowledged that in the last salary, and they appreciated it, but they did not did that, exposing themselves just for a salary. So we're doing good now. Pressure is fortunately going down, and that's a summary of what has happened. It's been a complete nightmare in Spain.
Thank you, Jaime. Again, it just demonstrates that it's not just about us, it's about the teams around us and everybody else that's part of providing that care to the populations that we're there to serve. And again, I pay tribute to all of you, but also to all of the staff that work with you or the people that you have contact with who have put themselves at the front line of this. My second question, if you can, fairly brief, and I'll start with Nadia this time. What do you think would happen? Given where we are, given what's happened, what do you think is going to happen over the next 4 weeks?
So Pakistan is now moving towards a smart lockdown, and the whole purpose of a smart lockdown is to provide relief to the labor class and the lower strata of society to survive economically alongside fighting the virus. And this is so important for us to understand this in lower middle income countries. And in Pakistan, we'll be selectively closing areas where the outbreak is experienced. Now, despite this, the pharmacist and the services provided by pharmacy teams will still continue to be available for patients and the public. And as you can appreciate, and we've heard this from other colleagues from other nations as well, there's a lot of uncertainty around this time. It's a novel virus that we're dealing with, and it's an unprecedented global situation which we need to prepare for. And I think as a profession, we are really showing our versatility right now, how flexible we are, how adaptable we are. But however, the conditions are changing rapidly as we get to learn more about the virus and how it's behaving. So we can't really say much. All we can say is we're taking it a day at a time.
Thank you, Nadia. Jaime, what about in Spain? Because obviously you're, again, the same thing. You're starting to come out of, potentially out of lockdown.
Yeah. Last Sunday was the first day out with my kids in almost 4 weeks. It was so strange to be outside with them back again, so happy. Well, things are improving. Fortunately, yesterday our government finally released the calendar to be back to the new normal in the end of June. Hopefully we will be in very good shape in mid-September when, as you all know, the FIP Congress is happening in Seville. So I'm very optimistic with the information that we have today, that we will be able to welcome you in Seville and show you why are we so proud of our Spanish culture, food, joy of living, weather. So hopefully it will be a great Congress. Regarding the future and the role of pharmacy, I think we need to have a big role in testing, not only taking the swabs, but also interpreting the results and uploading information to our healthcare authorities. And hopefully in a few months' time, having a big role in vaccinating. We are not allowed to inject yet in pharmacies, but I think this is a very good opportunity for everyone to take advantage of the strengths and value of pharmacy.
Yeah, well, yeah, as you say, everybody, if there is a vaccine, if they do manage to develop one, everybody will want it. So, and to be able to meet that need, we're going to need everybody to be able to do it, not just one profession on its own. Luna, what about in Lebanon? What do you think is going to happen over the next month?
Okay, I will tell you what is going to happen within the 2 months, because in Lebanon we had something which is important, that the government has put 5 steps or phases to back to the life. And this is really, in my opinion, very dangerous, because now I'm seeing people that's coming and saying, it's over, fine, it's good. So I'm starting educating people inside the pharmacy and outside the pharmacy, patients, neighbors, everybody, that be aware it's not over. We could have a second wave, and maybe it is worse than this one. So what I'm seeing, that until a vaccination or really a medication that is well known, we should still educate everyone, not our patients, everyone, about what we have to do, and still doing the social distancing, putting the mask when needed, etc., etc., etc. So this is my opinion.
Thank you, Luna. Again, yeah, because I think that's the thing, is this isn't over by any means. Nelly, in the Philippines, over the next month or so, what do you think?
What I can share is probably in the next 2 weeks, because we are still waiting for the cases to lower down. So for the next 2 weeks, we are still on lockdown, but the classes will now resume by September. So everything is going to be on hold until the outcome for May 15. That's the latest update from the government. For Cebu, we are encouraging everyone to stay at home to ensure that there's no more transmission. And the goal really is to have the testing, because we lack the test kits to be able to identify who are the positive cases. So from here on, we encourage everyone to stay at home, and then the goal is really to have the total the total count for the positive cases.
Thank you.
I think.
Thank you, Lenny. Again, I think that's part of the problem, is that we're almost trying to guess some of these things. And in a way, one of the things that struck me from your first answer was that we didn't expect what we had, and we're still trying to predict some of the things we're going to do in the future. I think it will be quite interesting. But it's curious, in a way, part of the reason for asking the question is then we can look back in a month's time and see how close we got to what we foresee as being what we expect to happen. So my third question, I'll start with Jaime this time. Oh, you talked about FIP. You've talked about just coming to Seville. I must be honest, I'm looking forward to it. Thank you. But how would you say FIP over this has been of value, and what do you think the benefit of these webinars and resources are to you and to your country and to your fellow pharmacists?
Yeah. Well, firstly, I must say that. It's been very useful and very practical, because I've seen the guidelines and information from FIP circulating in WhatsApp groups formed by pharmacists. So that's the best thing I can say about it. It's been super useful. I remember the first time I saw the guideline very early. It wasn't only the information, it was so comprehensive and so detailed that I thought, wow, this is really serious stuff. What is coming to my pharmacy? So it not only allowed me to implement specific measures regarding the shortages, protection. Luckily, I had personal protection equipment from the last SARS outbreak. So it helped me to not be too late with our protective measures. Also, I read there for the first time to do different shifts in my team, which I did. So I think it's been super useful.
Thank you. I mean, I think that's the thing in a way, is how do we all share what we're doing in respect to what we're doing? So Luna, what about in Lebanon? How's FIP been helped you there, and what's the benefit of these types of webinars?
As I told you, that thanks to these FIP webinars and guidelines, I would like to say to Haimi, it's not only, let's say, educative, but it was very easy, because, it was with different cases, what to do in this case, what to do in the other case, for the guideline and instructions for the pharmacist. So it was easy for my team to really understand it easily, and to do the applications with the patients very easily. And then the webinar, they were talking about different experiences in everywhere, and it was great. The first one was general, it was good, so we did understand what is COVID, since we didn't have it here in Lebanon. But later on, when we were there and it was here, and we had the, what you say in French, the apogee, so it was the maximum. So it was very important to know what we are facing and what to do. So it was great, and I really encourage everybody, for those who didn't watch this webinar, to go back, because you can see them. It's you don't need to be a member to look at this webinar. To go back to this webinar and really to have a look, because they are very important and helpful tools.
Thank you. And Nelly, what about for you? How's FIP helped out and these webinars?
The document really was very helpful, as what Jaime mentioned as well. Earlier on, it gave us an idea on how to deal with COVID and prepare the pharmacy, at the same time the hospital as well. And it also helped our interns in terms of having an idea what COVID is all about and preparing. But then again, you will never know what will hit you until it's there. So it's sort of surreal. This pandemic is like only in the movies, but then it happened to us. So I think we will have to be ready in the future. But FIP is very helpful. It connects us. It gives us a greater material to be in touch with each other.
I think that's really important, that sharing part, as all of you have talked about. And Nadia, what about in Pakistan? Have they been able to utilize the resources, and how do they use these webinars?
So FIP's the COVID-19 Hub has been a brilliant go-to during the pandemic, and sharing the experiences and showing support and solidarity in the fight against COVID. I mean, it's been an absolutely outstanding resource, and I'd like to thank Lena and FIP for actually putting all the hard work in and giving, making this available for pharmacists all around the world, not just in Pakistan. So the guidance for pharmacy teams, that's been very helpful and useful. And in Pakistan, we've adopted and adapted these guidelines and written our own 10-point guidance for local use, both in English and in Urdu. The guidance has been supported by FIP and also the Commonwealth Pharmacists Association, but it's also been endorsed by the National Alliance for Women in Pharmacy in Pakistan, our professional body, Pakistan Pharmacists Association, the Drug Regulatory Authority in Pakistan, and of course our Ministry of Health as well, which we are very proud of getting their endorsement. These are being widely used and disseminated and are available on the FIP website, as well as the Drug Regulatory Authority Pakistan's website as well. And what we're seeing now, which is really good to see, that pharmacies and pharmacists are printing this guidance on standees and banners and displaying them for their teams and spreading this widely. And I'd like to thank a community pharmacist in Pakistan who's been instrumental in actually disseminating this information, Ijaz Nadeem, so I'd like to mention him. But also, in addition, I'd like to thank Bisma Nair, who's developed these guidelines with me, but also to Reena Barai here in the UK and for Huma Rashid in Pakistan for their advisory role in writing this guidance.
Thank you. And I think that, again, just reflects how the ability to share information and share messages and then be able to work out how that works for each of us in each of our countries is really important, but also learning how things are happening, how things are changing, what people are doing, I think is really important. And for me, that's one of the things from these webinars is actually hearing your stories and hearing what's happening and how you're dealing with it is so critical to how we progress. Because one of the things that we're going to have to remember is that we started with what looked like being a sprint, but actually what we're going to have is a marathon. And this is going to be around for a long time for this time. And, you know, people talk about post-COVID-19. I think we're going to have to wait a long time till we get to post-COVID-19 and adapting our lives and all of those that we serve in the way that we talk about our the new normal, I think is going to be absolutely critical in our learning. I'm going to hand back to Lena now. Fortunately, Lena, I've managed to run us out of time. It's not going to be able to ask me, but I must be honest. In a way, this is more reflective. Just before I do, this is reflective in the sense that actually, what's really important is we hear these stories from these different countries, and that's the most valuable thing that I think in what we do, because these are the true heroes. These are the people that are making a difference to people's lives every day. So, handing back to you, Lena. Thank you.
Absolutely, Ash. I think we could stay on for hours. I think this really has been very humbling and sobering, and shows us the power of conversation and just hearing first-hand stories and also the second-hand testimonies. These are really powerful to listen to as well. And I just wanted to make a couple of comments before we do a little bit. We'll spend a little bit more time. We'll do a few more minutes because I think this is really valuable and this doesn't happen often. And I'm sure we're going to do a lot of these, but it's having you, this selection of pharmacy heroes, hearing firsthand your experiences. And I think I've been especially touched by, of course, the loss of life. And I think we're reminded here about COVID-19 being first and foremost, it's a humanitarian crisis, and we can feel it. And Jaime's first-hand accounts of what's happening in Spain, and we're very happy that you're well, Jaime, and sorry for the losses of all of the pharmacists around the world. And I think it's worthy to mention here that we have established in FIP a list to remember pharmacists that have basically lost their lives to this pandemic. And I would like to just invite everybody here and everybody listening to us to please send FIP the list and names of your colleagues, of pharmacists, pharmacy workers, pharmaceutical scientists, anyone affected by this, and we'll make sure that we honor their names on their website. And we have a section on our information hub, which I'll tell everybody more about, where we remember these pharmacists, these real heroes who have left us too early. So very, very humbling, very sobering, and just remind us of how powerful this is, how extraordinary it is what we're going through. I've also just picked up some threads that keep coming, and I know, Ash, you've said, and we can see so many differences, but so many similarities. Issues on mental health and resilience of the workforce, and how stressful this has been for everybody. And I think we can feel that. There's a lot of uncertainty, especially at the beginning. There's still a lot of uncertainty as we go forward. And I think this is one of the issues we're going to focus on with through the online program, is also delve deeper into how has this impacted the mental health and of pharmacists and pharmacy workers, and how we can empower everybody to be more resilient, especially as we keep going through uncertainty. Another issue that we will for sure focus on is that the fight still goes on. And of course, I think now it's about control, but Jaime has mentioned this. This is about what's next. This is about the role of pharmacists in vaccines and delivery of treatments, hopefully when these become available very soon. So I think that this is just starting, and you've said it, Ash, it's a marathon and it's a long one, and there's a lot we are still yet to give in. I think I want to maybe ask you, Ash, since you're with us. And Ash, you wear a lot of hats, and I think it's worthy to just explore a little bit of that. I know you're also a community pharmacist, so you are at the front line. You are a pharmacy hero. So kudos to you as well. But I want to ask you about your work across pharmacy organizations. So you have several executive positions, being vice president of FIP, but also an executive at the Royal Pharmaceutical Society, so it's a professional body on a national level. Tell us behind the scenes in terms of how these organizations, how can we serve the profession? How has it felt on the front line, but also behind the line, if I can say that? And how are all these things appearing elsewhere, impacting what you're doing from within this organization? So I suppose it's a very big question, but it just would be really great to also hear your views on this.
So I suppose the thing that strikes me about it is, in a way, it's very reflective of everything that people have said. From a personal point of view, it's the ability on the front line to see what's actually happening, to be dealing with the patients, dealing with their stress, their emotions, in the same way as I'm dealing with the stress of my own staff, dealing with the pressures that I'm under, dealing with the stress in my family, because my family, worry about the fact that I'm going out every day, they're at home, and I'm coming back, and am I going to be all right? And all of those types of things, again, just become part of what we have. So from a personal point of view, there's very much a bit about from the front line of how all of those things interact and cause pressure for yourself as much as for anybody else, and how you deal with it. But as a result, also then what it does, it makes you think about from an organizational perspective, any organization, what is it that is affecting your members and what's affecting the people that are out there, and what is it that you can do to help them to do their job most effectively? How can you help them to be the best they can be? Because that's what everybody wants to do. They're there to provide their best. And what can we share and what can we learn, and how does that help everybody to be able to do that more effectively? At the same time, the other thing that's struck me over the course of this has been, there's been a huge outflowing of gratitude and recognition of pharmacists and the role that pharmacists are playing within all of this, and the fact that they are the front door in a way of health now across the globe. But at the same time, there's still this challenge about how well they're recognized by government and by the public on an ongoing basis as we move beyond this. So part of the responsibility, I think, from an organization perspective, is to make sure that we continue to tell the story of what pharmacists are doing, but also tell the story of what pharmacists can do and how they can make things better going forward, and how they can help in some of these things. Take the example of home use vaccination. How do we globally, from an FIP perspective, demonstrate the real benefit that we can get from pharmacists being involved in vaccination programs to achieve the goals that we want to? How do we make sure that people understand that as medicines we start to understand which medicines may help in treatment of coronavirus? How do we make sure that we're seen to be able to support that and to be a key part of providing care around that? And from an organization perspective, making sure we share that information effectively. Dealing with some of those challenges that we've had around chloroquine, hydroxychloroquine, antiseptics disinfectants that you may decide you want to inject in some shape or form, various things that we've heard across the globe in terms of the things we can do. How does pharmacists, do we know how we're able to separate what's true from what's not? Because actually, in a way, we're going to be the place that people are going to come to for true information, for confident information, and to be able to deal with the fake news to a great extent. So from an organizational perspective, is to be able to support that and to ensure from a member's perspective, in whatever guise, as an organization or as an individual, that you're able to access the best information available to provide the best care in the best environment at the right time for everybody that you serve.
Thank you, Ash. That was a very powerful message, and I think it's worth also noting what we do and what health organizations around the world do, including FIP. We can't do it without our pharmacists. We can't do it with our members. We can't do it without the frontliners who are telling us about their experiences, who are informing us, who are telling us about their needs, which we are responding to. And ultimately, our role is to serve our members, to serve pharmacists, and to serve their needs. I think one last rapid question to everyone. Since we have a lot of pharmacists and pharmacy workers listening down the line, this is a chance to send a message of solidarity, if you like, to colleagues around the world. What would you like to say to pharmacy colleagues listening to you now. I'll start with Luna.
Okay, I would like to tell them that you are really the heroes because you are always in the front line. We are really the only healthcare provider that are always on the front line all the time. So a big hello, a big courage, and also please stay all the time educated. I know I'm going always talking about that, but because we have to be updated and to help our patients with our updated news. So bon courage, comme on dit en français, like we say in French. So good courage, high courage. Okay. Thank you.
Thank you for that, Luna. And I think we have also Piotr down the line, and I'd like to just call him back in to maybe share with us a message he'd like to share with others.
First of all, thank you very much. I would like to tell to all my colleagues, first of all, do not be afraid to show that you are important. And every day you are basically fighting with pandemia. You are helping people. As I said, probably the same, because whatever I heard from you, it's exactly the same scenario in Poland. So I believe it's 88% of surgeries that are closed around the world. So I believe that you are frontline heroes. And you help many people, and not only about medicines, but also mentally, to just have a chat. Because when everything was closed, you were the only people who were front-facing the patients and helping with all the problems, also mental health, like you said. So good luck, basically, don't give up, and we stay together for patients.
Thank you for that, Piotr, and thank you for also leading the Pharmacy Heroes campaign, which does give a voice for pharmacists everywhere. To show us what they're doing and how much they are sacrificing. Jaime, what would you tell the world?
I would just say, my colleagues, in Spanish it would be gracias. In English it would be a super big thank you for taking the risks and for your service. Keep it up. This is not finished, but it's worth every effort. We're doing a super good job. Despite all the pressure, we are shining, and patients and health systems are taking good note. This is pharmacy.
Thank you, Jaime. So powerful. Nelly.
We will win this war. So just keep up the good work.
Thank you, Nelly. That sums it up perfectly, I think. Nadia.
So pharmacists are the backbone of healthcare and are now being recognized for their excellence and for being at the front lines during the COVID-19 outbreak. Be proud, be safe. And in Urdu, we've got our hashtag going for pharmacy in Pakistan, hashtag Pharmacists Zindabad, which means long live pharmacists.
Long live pharmacists, long live pharmacy. Ash, on behalf of FIP and me, what would you like to tell the world?
So believe in yourselves as pharmacists, recognize what a fantastic job you are doing, and most of all, keep safe and keep well, because if you don't look after yourselves, you're not going to be there to provide the care for the other people that you're there for. So remember yourself just as much as you remember everybody else.
Thank you very much, everyone. And with these powerful messages, we will wrap up today's episode. I would like to sincerely thank our heroes here with us today, Piotr and my co-moderator, Ash, our partner, Polish Pharmaceutical Group, for helping us deliver this episode. This episode has been recorded, and the recording is freely available to everybody. You can find it on www.fip.org/coronavirus. And this is the Information Hub webpage that includes all of our COVID-19 resources that our colleagues today have mentioned, including the guidelines, free webinars, as well as guidelines from other countries around the world that might help you deliver services in your countries during these times. This is also an opportunity for me to invite you to also join our new Facebook group, COVID-19 and Pharmacy, where you can join a global network of pharmacists discussing the pandemic. And this is a chance for us all to continue this discussion. This is an ongoing discussion, and we do need to keep talking to each other. One more thing, if you'd like to feature in one of our upcoming Hearing from Our Heroes episodes, you'd like to share your story, please email me at lena@fip.org. Before we close, and I think we're just closing back the loop, coming back to the Pharmacy Heroes campaign, we'd like to ask all of our guests here online on video to show solidarity to Pharmacy Heroes. I know, Piotr, I think we know how to do the peace sign with our hands. So we're going to do that. get a screenshot and then circulate that. Is that the right way?
I think so.
Yes. It's not very easy when it's video. I'm going to ask our colleague Aslan to please take a screenshot of this, and we're going to help support the Pharmacy Heroes campaign.
It works perfectly fine. Perfect. You're all great.
Thank you.
Thank you very much. With this, I'd like to thank everybody and looking forward to speaking to you very soon. Thank you, everyone.
Thanks a lot. Thank you very much.
Thank you.
Be safe.
Bye.
Take care. Bye.
Be safe. Bye-bye.
Bye.